So what might cause schizophrenia? One of the ways researchers have been trying to answer this question is by looking at the structural differences that might exist in schizophrenic brains. For the longest time, researchers came up empty-handed. Schizophrenia was referred to as the graveyard of neuropathologists. Over the past few decades, however, a few clues have emerged. People with schizophrenia have larger than average ventricles, the fluid-filled cavities within the brain. Tied in with this is the finding that schizophrenic individuals have less than average grey and white matter, though the increased volume of ventricles is not directly tied to the loss of brain tissue. Diffusion tensor imaging studies have indicated abnormalities in the white matter connecting distant brain regions, and new research suggests that the abnormalities are caused by both the axons themselves and the myelin sheath that surrounds them, disturbances in the functional integrity of the white matter. This pattern of results is indicative of abnormalities in information processing and cognitive deficits, which is consistent with what we already know about how people are affected by schizophrenia. Some studies show greater loss of grey matter over time, supporting the notion that schizophrenia is associated with the progressive loss of cerebral tissue. Cortical grey matter appears particularly sensitive to change, and the progression of cortical volume changes seems to affect the left hemisphere more than the right, supporting previous findings of abnormal hemispheric asymmetries in chronic cases of schizophrenia. At the microscopic level, researchers have shown that schizophrenia may be associated with slightly smaller neuronal cell bodies, especially in the hippocampus and prefrontal cortex. Are there neurochemical differences that might explain schizophrenia? There is some evidence for elevated dopamine release, though schizophrenic and healthy individuals have similar levels of actual dopamine. This might be explained by the fact that people with schizophrenia have twice as many dopamine D2 receptors occupied at any given moment. Glutamate has also been implicated. It is released at a lower than normal level in schizophrenics, and there are fewer than average glutamate receptors in the prefrontal cortex and hippocampus. Because schizophrenia tends to run in families, researchers have long sought a schizophrenic gene. Some genes are more common in schizophrenics, but there is no consistent link to a single gene. Scientists now realize that most inherited disease factors aren't single genes, but combinations of different genes, and these combinations can be quite complex. Genetic variability is important in evolution, and natural selection and new mutations are a critical aspect of this process, but not all mutations are adaptive. Those that are less adaptive should reduce survival, i.e. reduce the likelihood of passing on the maladaptive gene. Schizophrenics generally have less children and die at an earlier age, but ongoing mutations, microdeletions and microduplications of parts of a gene that cause abnormal brain development, may maintain prevalence at the 10% mark in spite of this. Genetics obviously plays a large part. Individuals who have identical twins with schizophrenia have a 50% chance of developing schizophrenia themselves. But if schizophrenia was completely determined by genetics, that percentage would be at 100%. Schizophrenia is not about nature versus nurture, but about the combination of nature and nurture. And nurture is not just about how you treat a child. It is any effect of environment, including what happens during prenatal development. Both poor maternal nutrition and stress have been implicated as prenatal factors that may influence the developing fetus. What happens if the mother gets sick during pregnancy? Could that impact the fetus's developing brain and increase the risk of developing schizophrenia? Research suggests that indeed it can. Influenza exposure during early to mid-gestation is associated with a threefold increased risk of schizophrenia. First trimester exposure to influenza is associated with a 7-fold increased risk. 20% of adults who were exposed to rubella, German measles, were later diagnosed with adult schizophrenia, suggesting a 10 to 20-fold increase in risk above the general population. Toxoplasma gondii, a parasite, is a well-known central nervous system teratogen. The children of women who have high levels of antibodies to this parasite during pregnancy have a 2.5-fold increase in risk of developing schizophrenia. Studies have reported that adults who have schizophrenia had a greater exposure to cats in childhood. While not definitive, these findings support recommendations to minimize exposure of the mother to cats during pregnancy and to limit early childhood interaction. If this cannot be avoided, care must be taken to minimize the transmission of the cat's fecal matter. Even without infection, a mother may produce an immunological reaction against blood type differences. This complication can arise whenever a woman with Rh negative type blood carries an Rh positive fetus. If incompatible fetal red blood cells cross the placenta, they may trigger the production of substantial amounts of maternal antibodies. In subsequent pregnancies, these antibodies recross the placenta to the fetus, where they can affect healthy development. The severity of this process can increase with each pregnancy, so each subsequent infant is more likely to be affected. Today, screening measures to identify Rh incompatibility are widespread. Finally, researchers are also exploring the possible impact of fetal head injuries or lead exposure, and there is evidence that marijuana during adolescence may also increase risk in genetically predisposed